Come on. Resume recording.
People on there. Talking to myself and feeling old.
Okay. However, it's not telling me that we're recording, so I'm gonna double check that. Computer recording is on.
Don't furrow your brow, woman. That's good. These,
I'll get different ones.
I
Either
know,
direct.
go neutral.
Right. Oh.
It's too late for that.
I've been trying to do that. It's not working.
It's too late for that.
That's why I have babes.
I'll put more retinol on tomorrow.
Okay, whenever you're ready.
Okay. Calling to order the Fallbrook Regional Health District Strategic Planning Committee meeting on June 17th, 2026 at 5:33. Right?
Thank you. Yes.
Yeah. Okay. Calling the meeting to order and roll call, please.
And we don't need to roll call because you're both physically present.
That's true. And then do we have any public comments or announcement?
Nope, nobody online. We received nothing via email and nobody but us chickens in the room.
Okay,
That's it.
very good. So we'll begin one of three discussion items, and I just want to thank Rachel, because I know how much work it is to gather these kinds of RFPs.
Just so we're all clear here.
Yeah, there you go. Refresh my memory, we had 10 submissions.
16 altogether.
16 submissions. And we have rarefied the candidates to 3 tonight. And I would be interested, Cindy, we have the 3 top that rose in Rachel's mind, and I took a peek too. Do you have a sense that those are the 3 we should be discussing, or do you have a 4th you'd like to add?
No, I'm comfortable with those 3.
Okay. And of course, cost is always a concern.
Yeah.
For me, capacity of the organization and experience is very important, and I'm viewing these 3 with various degrees of that. So, did one of those 3 jump out to you, Cindy?
I focus on the cost. Like, whoa. But I mean, they're pretty reasonable compared to some other ones that I saw.
Yes, yeah, I was gonna bring that up. These are very much,
Yeah, some of them are ridiculous.
yeah.
And then just as a side note, even though submission number 6 and number 10 both came in the under $40,000 category, there was some substantial things that they left out. So I didn't rank them high based, even though they were less expensive, because they left too many things out.
Oh, yeah, no, thank you for not.
Yeah.
Incomplete is incomplete. Okay. So, of the 3, is there one that you would prefer over the others, or do you want to talk about your view of each of them, or perhaps what are you thinking?
I'm not strong on any of them. I mean, they have that.
Right.
I'm gonna have the work that you do. Because it always just like, oh,
Yeah.
my brain was just rotted after.
Yeah.
I
I get
couldn't
ya.
do it.
Yeah.
So what I noticed about sowing, first of all, I like the idea they're sowing seeds, but that's the same. The 3 things that mattered the most to me that I looked at the 3 applications through were, first of all, capacity to do the work. It's so important that the consultants have enough resources and brain power, and I felt they met that.
Mhm.
I appreciated that they are committing to our bilingual population.
Mhm.
And the third thing is, they have actually done a health district's community assessment.
Mhm.
And health districts are different than school districts, are different than fire districts, as you know,
And different from counties.
and different from counties. Lots of consultants do counties. So for those 3 reasons, I ranked Sowen as number 1. And I would ask for a conversation around that.
No, I do like that a lot too. Well, for me, well, I think it's, I'm Hispanic, but the bilingual thing.
Totally. If we
Yeah.
don't get that right this time, we won't build for the future. And we need data in order to help people understand the why.
Yeah, and it's also, I mean, we're not gonna get everybody on the first round, but the fact that we're trying, we're gonna be like, voices out there. Oh,
Yes.
it's just happening.
Yes. And I have a question of you, friend, no matter who we pick. Last year, we had difficulty because of time constraints to do an adequate pulling together of key Latino leaders in our community,
Mhm.
including parents. It was very difficult. But you and I both know we have some existing groups
Yeah,
that we want to get in the loop early, so they know time, date, place. This is where you can help us. We can work with the school district for their existing English language proficient groups.
yeah, my dad was the president for a couple years.
Exactly. So, and we want to get students,
Okay.
okay? So, we'll put together what we know so that Rachel knows how to help them.
Okay.
But we have a good timeline. We have enough time to prepare for.
Okay.
And that's gonna be really wonderful for us.
Yeah, I can help with, the ELAC at the Fallbrook Junior High School.
Good,
I know the people that are there.
good.
I also know a couple of teachers at the Mayhalis. It's a school too, that I can tell.
And I can contact the, bilingual education administrator at the elementary district and at Bonsall, because their existing parent advisory groups are key to us.
Okay.
They represent the big, yeah.
And the high school group, I think, is gonna be one of the most important, as we have talked about, our youth programming.
Yep.
We're not talking about just little kids, we're talking about the
Youth.
young adult.
To 26 or something.
Yeah,
I agree. So we'll get the word out after we look at our backwards planning. Refresh my memory when we thought the kickoff for this effort would be.
we actually had it scheduled to kind of start around this July timeframe. We'll push that closer to August, just because we're a month off from our original contracting date. But that'll be more, organizing, planning. Almost all of them called them basically their phase ones.
Yeah. the big
So probably it would end up being maybe October.
would be the vibrant time. That's perfect because the students will be back in school. I'm talking
Yeah.
about student voice.
Yeah,
Students will be back in school by then and we can get with their, the different teacher leaders who can get them to feel vested in this, who then will show up.
Yeah.
And we'll have food.
yeah.
Exactly.
We'll have food. Very good. So are we of a mind to recommend to our colleagues next week? Sorry, in July,
Next month.
that we award this to them?
Yeah.
So let the minutes note. Very
Okay.
good. Thank you so much.
All right.
Well, and I didn't want to bias the decision, but probably the best Zoom call I had was with the Sowen team.
The whole team.
Well, not the whole team,
No,
but
but I mean,
it was multiple people.
not just one.
And it, because it was so just subjective, I couldn't say that that was a measurable for me.
Yeah.
But they're just, the way that they dialogued with me was much more receptive
Mhm.
than a few of the others.
Mhm.
And they've been very communicative about just different things like, oh, I want to ask this question. Oh, without being annoying, like, listen, we've already discussed it 5. So just as a side note, since you already said that you like sewing, I wanted to just give you that little bit of feedback as
But that's
well.
also important because they're gonna be working
Mhm.
closely with us.
Yeah, I mean, with Teresa all the time.
Yeah.
That's what I was gonna say.
Oh.
Vibe.
Good to know.
We may not be able to measure vibe,
Exactly,
right?
exactly.
And
But they just were a good fit, and Chris, the previous CEO at Desert, just before they even had their application into us, said how much of a joy they had been to work with.
we like Joy.
Yeah,
Yeah, and the fact that it was a health district really rang my bell.
Within our proximity
That's
even.
right.
Yeah.
Okay, excellent. Review and extend Michelle's Place grant agreement for cancer support services. I just want to say, resume and extend. So we'll be recommending extending. Just, I have so many occasions, don't ask me why, where hospice comes up.
Mhm.
I mean, even beyond us, and Michelle's always comes up.
Mhm. Well, I mean,
They're
Michelle's
very-
Place has,
they're
because
so
they so
unique.
many cancer stories.
Yes.
And unfortunately, many of the cancer stories end up being referred to hospice at the later ends. And they have such a seamless movement.
Yeah.
It's
And
a
it-
strong suit.
And it's also like, something beyond reputation,
Mhm.
the whole idea of why it was founded. Somehow it's
Mhm.
gotten into the mainstream thought and recognition. Very cool.
Mhm.
Do we have any questions about Michelle's Place being extended, Cindy? No. Okay, very good. Perfect. So we'll forward that on.
And the reason, the annual amount is the 42,500, but because it's a 2-year contract, the total amount of the contract goes beyond my signing, which is why it comes to committee and goes to board.
Gotcha.
Just so we're all clear on why that process is.
Okay.
Yeah.
Got it. And then, item C, 3C, review and revise North County Fire Protection District ambulance grant agreement. We have a local expert on this. Cindy, anything we need to know or consider?
No, I'm also reading, they were, they're doing pretty good. They're doing pretty good.
And the difference between this grant and the previous is that we went from a multi-year down to a single year. And we went from $2,000 of support each year down to $100,000. And the goal and expectation is with clinical services coming.
Yeah.
That should lessen a lot of their, not really emergency level calls, but because there was nowhere else for those people to go, they ended up calling for the ambulance. With having clinical or urgent care in town, folks can do that drive or get a ride, whereas before there was no one else.
Yeah.
Well, if I may go personal for a minute,
Mhm.
Sunday night, I just had this huge pain. I thought I would pull my back muscle because I've been lifting books and rearranging stuff, Well, 2 hours later, it's like, something's wrong. Something's wrong. I couldn't sit, I couldn't stand. I walked around for about an hour thinking it was hey. And I started thinking, I said, this could be a kidney stone.
Mhm.
This is what people tell me it feels like.
Getting shanked right in the,
Right.
yeah, that's what it feels like.
And it's midnight.
Oh,
it is.
So we have an agreement in our household. If someone goes to the emergency room, we all go. So. Wiki. La 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 la. Oh, Mary. There we are. The bump the bump. Well, I had looked up an urgent care in Temecula, 24 hours.
Mhm.
Okay, so we go there.
Mhm.
We walk in and they said, hi, what can we do for you? I said, well, I have a very bad pain back here. We have no imaging here. You need to go to the emergency room. Okay. Can we talk to our partner and make sure they have imaging at the urgent care? Bring it up.
We will be discussing it with them. The plan was that they would have at least basic imaging, which might mean X-ray, but probably not MRI. And for kidney stones, they're gonna usually either CAT scan or MRI.
Yeah, CT.
Yeah.
So, okay, so.
But that is already on the short list.
I appreciate that. I
Yeah.
can appreciate that. And I can see why they probably won't have a CT and certainly not an MRI, but, it's a piece of it. But.
Yeah.
So, short form, we got there at 1-ish AM-ish, something like that. We walked out at 6:30 AM.
Yeah.
Now, we were on the walk-in side where
Yeah.
the wounded come in. The other side is the ambulance. I mean, they were so busy on that other side.
Were you at,
Temecula.
Temecula Valley? Yeah.
They were fantastic.
Mhm.
I can attest. They were fantastic. The staff was great, the consideration towards everybody. That lots of different people came in. One of them is a perpetual, I'm sick, and they have a little, I say, well, now, Elma,
Oh,
you be there, we'll
For-
check in with you frequently.
first name basis.
Lonely, something going.
Yeah.
Anyway, it was highly appreciated. And sure enough, the new stuff. And once you get one,
Yeah.
so new regime, la la la. I mean, I don't salt my food. I don't, I mean, I do.
Yeah.
So your
Don't eat
cheese
red
dairy,
meat.
your cheese dairy has to come
Go
down.
And I have to stop taking my calcium supplement.
Yep, and you have to
because
drink a lot more water.
I'm shoving it down.
Mm.
Welcome to my world.
Oh, God, okay, I'll be coming to you. But I drink a lot of water anyway. I always have water with me, so what the heck? But anyway, it's one small. We'll see what happens.
Did they give you the medication to help try and flush it? No.
No, no. But they did what they were supposed to do and they communicated well with Dr. Wong at Graybill, blah, blah, blah. Anyway, it was quite an adventure.
I don't love them. I don't
No.
recommend them, but
No.
they do.
Yeah.
And you will begin to recognize the symptoms early.
Oh, they're
Well,
awful.
oh my God, oh my God.
Awful,
It was
awful.
awful.
Mhm.
And I wasn't nauseated and I didn't
Oh.
vomit, but they sent me home with anti-vomiting and
Yeah.
Oh,
anti-nausea.
that was
Yeah.
nice.
Sorry,
Because
the
if
details.
you begin to pass the stone, that,
Eh.
because that's what happened
She
at,
did offer me morphine.
yeah.
She said,
Wow.
"Oh, that's the pain." And I said, scale of 1 to 10. She goes, yeah. I said, well, I give it maybe a 6, but I have pain threshold. And she said, do you want morphine? I said, no. She said, okay, here's 2 500 mg Advil. Okay, off I go. Yeah. Anyway, very much surprising incident.
Oh, yep,
Yeah. So stay
Not
healthy,
fun.
people.
yes.
I got mine in Cozumel.
Check
So,
now that's
yeah.
all. Oh, God. So that's all on tape. Very good.
Yeah,
All right.
Wonderful. It's a health related discussion.
absolutely.
And a report on one of our providers, regional providers, and top drawer. Okay, that was a board member comment.
You want to talk about, any injuries or anything you got?
Good, good, stay that
We don't
way.
want anything to happen.
No.
Don't worry.
But
No.
My friend works at,
Oh, does she work the night shift?
yeah, she does,
What's her name?
Emily Person.
We did not have an Emily on our team.
I think she just came back from, she was up in San Francisco. She got sent over there by the hospital.
Mm.
But yeah, she's just like, it's so empty.
Yeah.
Oh, compared to San Francisco.
The my side of the emergency room, we never had more than 6 people in there.
Oh, you're
Wow.
you're lucky.
Yeah.
That was,
They were
it
all
was,
over the ambulance side.
wow.
Yeah. Okay, any future agenda items we want to ask to be put on the agenda, Cindy?
The only thing that we'll be bringing forward is the team. We did a mission, visions, values workshop. And then Teresa and I just had a meeting to work on district branding theme so that we could really make sure that we have a solid direction around our initiatives.
Good.
So we're gonna probably work on tooling down some of that language, and we'll bring that back to the committee for
Good.
consideration as well.
That'll be very helpful in the community assessment,
Yes,
because our consultants can start embedding with these smaller groups.
Mhm.
You want to embed this in their mind and hearts about what we are.
Right.
That's perfect.
Right.
And we might even by that time have a little more concrete information about, what,
yes,
the clinical services.
yes.
That would
I'm
be if you
hoping I've
embed in there.
been allowing the election to be wrapped up
Yes,
so
ma'am.
that the partners can be,
And do you know 80%? It got 80% approval.
which
Yes.
is,
This is UCSD
or
part.
no, Sharp,
Sharp.
Tri-City.
With Tri-City.
yeah.
That's so good.
That's a huge population to vote yes.
Yeah,
on.
absolutely.
Yeah.
Well,
I mean,
They all recognize.
yeah, but I mean, even before this partnership goes through, Tri-City has turned a corner. They
Yeah.
completely renovated their emergency room. So don't be afraid to go to their emergency room next time. They have solved a lot of the big financial woes. Not that they don't still have challenges. The merger is still very smart, but they're coming in much stronger than when these conversations first came forward 3 years ago, I
Mhm.
think.
Yeah.
So
Well, I'm so happy for Dr. Ma.
he's amazing.
He's their CEO. He's a wonderful man. We had conversations with him here
Such a
and
great
his
guy.
CBO guy.
Yes.
He was also wonderful.
Yeah.
So glad that things have turned a corner for them.
Yeah, they've really done a good job. And what's crazy is Dr. Ma was an emergency room physician who has turned into an amazing administrator, business person, which let's face it, anyone who's worked around
Mhm.
doctors knows those two don't usually get
No,
along.
yeah.
And he's just a truly kind,
Yeah.
thoughtful person
He really is.
to boot.
I love
But
it.
he's also a girl dad, and I think
Mhm.
that's what did it.
Yeah, I think so too.
I think it's what, 3, 4 daughters, I
Oh,
forgot now,
yeah.
but very, very, very kind individual. Yeah.
That's great. Okay, I don't think we have any other business, do we? I am going to adjourn this meeting at, let's call it 5 till,
Thank you.
or 5:55.
Yes.
Cool.
Perfect. Thank you, ladies, very much.
Well,
Appreciate it.
You? Are you taking classes this summer?
No, I'm not.
Oh,
I'm
good,
in
you're
a break.
taking break. Good.
Yeah.
And when you go back in the fall?
I'm not going, I'm going to Germany.